thank Professor Javed Akram, Professor Aftab Mohsin, Somia Iqtidar, and her team who has invited us to come here and give us the opportunity to present in Pakistan Society of Internal Medicine. So it's an honor for me and Sumbul to come all the way from California. The topic which I selected today, and actually I wanted to discuss because we were all talking about diseases related to patients actually and patient management. Here I'm focusing more on physicians' health because this is one of the most neglected area where we don't try to keep our physicians healthy. So before I would like to talk about role of physicians' health and their personal health, I would like to briefly explain you about what lifestyle medicine is. So basically, lifestyle medicine uses evidence-based lifestyle therapeutic approaches to prevent, treat, and sometimes reverse lifestyle-related chronic diseases. So the word reverse, which I mentioned here, it means that even if somebody has developed some kind of abnormality, that can be corrected, so there is a reversibility there with lifestyle change. Lifestyle medicine is the application of medical, behavioral, motivational, and environmental principles to the management of lifestyle-related health problems in a clinical setting. Physicians act as both medical expert and a coach. The basic component of lifestyle, healthy lifestyle, predominantly whole food, plant-based diet. So I'm going to go very quick because I have time limitations. I've cut down my talk from 15 minutes to 5 minutes, so I will just go very fast. Regular physical activity, adequate sleep, stress management, avoidance of risky substance, use of other drug modalities that promote health and prevent disease. History of lifestyle medicine, I'm not going to go in detail of that, just briefly. Like Hippocrates, he said, let your food be your medicine and medicine be your food. And Sumbul will explain later. In our office, 78% visits, patient visits, they are lifestyle-related medical conditions. And what are those conditions? Obesity, metabolic syndrome, hypertension, cardiovascular disease, dyslipidemia, arthritis, diabetes, osteoporosis, and so on. Even malignancies like breast cancer, they all are connected with lifestyle. 80% of premature deaths, they are due to tobacco use, poor diet, lack of physical activity. Scientific data supporting that physicians who practice healthy lifestyles are more likely to offer counseling and well care to their patients. So those physicians who live healthy life, they promote healthy life. And that is why it is very important to fix physicians first before you are targeting your patient population. And why? So, physicians are not consistently practicing healthy behaviors. In a survey done in 2012, 53% primary care physicians were obese. In Canada, there was a survey done by a medical student. 36% did not meet physical activity guidelines. And there was another survey done in California in 2009, which shows 53% had severe to moderate stress, 35% never used to do exercise or occasional exercise, 6 or fewer hours of sleep in 34%, 27% never had breakfast or occasional breakfast. 13% used sedative and tranquilizers. So that shows like if they don't have a healthy lifestyle and they have a stress in their life, they were not even sleeping well. So there's something wrong. 7% depressed. I would say that number was higher, but here they mentioned 7%. And 4% used marijuana. So basically they did this survey with 750 physicians, and the turnout was only 41%. So the rest of them, they refused to complete that survey. So how physician personal health impacts patient care? So doctors who exercise are more likely to counsel patients on exercise than who don't. Non-smoking physicians are more likely to emphasize the risk of smoking, more likely to record a diagnosis of obesity and initiate a conversation if they perceive the patient's weight to be more than their own body weight. If physicians eat less fat, they counsel more on cholesterol. If they eat 5 fruits and vegetables per day, they counsel more on nutrition. If consume a vegetarian diet, are more likely to counsel on weight loss and nutrition. So what are the basic strategies which can help physicians improve their health? In Western world, we have different kind of practice setting. In Pakistan, we have different style, but the basic concept is ensure providers have access to physical activity opportunity both in and outside the provider's office. Promote healthy meals in and outside office. Install standing workstations so that we should not be sitting most of the time. Use technology to assist in tracking activities and to engage colleagues in health challenges and competitions. So one of the simple things is have an app, Fitness Pal, which helps counting your calories to your activities and your diet, and involve in local communities changes that support healthy living. Just briefly, I'm going to touch, I'm not going to go in detail of nutrition. Maybe Sumbul is going to talk about that. But what are the overconsumed foods we do it in our everyday life? So regarding nutrition is one of the pillars of lifestyle. Added sugar or high fructose sugar, overconsume, cholesterol, animal food, saturated fat, sodium, trans fats, and processed grains like white bread, rice, and white pastas, they're overly consumed. And we should focus on these things, not to do too much. And then we have some nutrients in our food which are deficient, We don't pay attention to these vitamins, some electrolytes like calcium, magnesium, fiber, potassium, vitamin C, vitamin D, vitamin E, and K. And the ideal source is your natural fruits, your vegetables, and grains, beans. So they are a good source of all these antioxidants and nutrients. And then we should focus on nutrient-dense foods. Foods which have the most shortfall nutrients with least overconsumed nutrients per calorie. And they are vegetables, herbs, spices, fruits, legumes, whole grains, nuts, and seeds. Epigenetics, we have been told multiple times during the last 2 days, like we talked about genetics, and Professor Javed Akram also touched that topic as well. And epigenetics is a study of the non-DNA sequence components of genetic inheritance. These sequences act like gene switches that modify and control gene expressions through DNA methylation and other processes. And epigenetic consequences are passed on from parents to child as set switches. So we turn on and off our switches, and that can lead to the problem. Lifestyle and diet have a major influence on your epigenetics. So you have some control of your genetics as well through epigenetics. One of the key message I'm going to tell all of you guys, focus on whole food, plant-based diet. I know we all love meat, but discourage as much animal food as you can. So whole food means like an apple which is coming from tree as it is. So this is how we should be eating vegetables and fruits, because it improves insulin sensitivity. And what are the other benefits of having plant diets, Because most of the time we think fiber is only to form bulk in our colon, but this is not true, because you feed your microbiome by having natural fruits and vegetables. Physical activity, as much as you can, whatever you love, you need to do that. Exercise, it's a purposeful physical activity that is organized, planned, and recurring, and that is done with the intent of improving or maintaining one or more components of one's health. Physical activity guidelines for everyone, physicians or patients, so whosoever you are guiding, 150 minutes a week of moderate intensity physical activity, 75 minutes of vigorous intensity physical activity. Any amount of physical activity is important, better than none. Additional health benefit, if somebody wants to lose weight or somebody wants more pulmonary fitness, they need to add more minutes to it, like 300 minutes in a week. Strength training 2 to 3 times a week. So when we age, we think we don't need to go to gym. Actually, we are the one who needs gym the most. Why? Because our muscle quality improves with strength training, and this is how insulin sensitivity improves as well. Stretching is another important part of our daily, should be our daily routine. And 10 minutes of stretching, even if you go for a walk and you come back, do like 5 to 10 minutes of stretching, which is important. It prevents you from injury. Sleep is another, benefits of physical activity. It improves sleep and it improves brain executive functions. Depressive symptoms gets better. There are studies on exercise and depression. It is a treatment of, one of the treatment of depression is increased physical activity as well. Quality of life, your physical activity improves, and physical functioning improves with physical activity. Then another part of physician health is emotional health. So as I mentioned to you earlier, that physicians, they do get depressed, they do get anxiety, and we need to focus on their emotional health as well. And because if somebody is depressed, depression can lead to coronary artery disease, depression can lead to diabetes, but it's a bidirectional actually, and those diseases can cause depression as well. So we need to focus on physician health as well. Some of the components of emotional health, like connect with others, like family, friends, get involved in activities, listen music, exercise, dance, everything matters actually, because the bottom line is you need to change the hormones in your brain. Spiritual need, counting blessings, celebrate your successes, regularly practice kindness. So these are things which can improve your emotional health. And stress is very important for us, for all of us, because we are under stress all the time. What stress does to your body? It raises blood pressure, it increases heart rate, it increases muscle tension, it disturbs your hormone. Cortisol level stays high in patients or physicians who are under stress most of the time. Even your GI tract can be affected because you eat more, you eat less. Some people, most of the people, like they eat more actually with stress. And then we need to know how we can relax it. So what relaxation does to you? It decreases heart rate, decrease blood pressure, decrease in rate of breathing, and decrease in muscle tension. There are some non-pharmacological stress management techniques, very simple: mindfulness exercises, meditation, relaxation, abdominal breathing, expressive and pursuits like dance, music, singing or art, massage, Tai Chi, volunteering for meaningful purpose, which is like volunteer work, spiritual and religious activities, regular time in nature. And for my patients in Pakistan, when I talk to them, because for them it is very hard to remember everything what I'm talking, but I have a strong belief after doing all that lifestyle, integrative medicine, I came to a conclusion that our namaz is a perfect lifestyle. A person who prays 5 times a day, especially when he goes to masjid, he has a 50 minutes walk actually, minimum, and it at intervals, and sometimes he walks more actually, so he probably touches 5,000 to 7,000 steps a day when he's doing this activity, plus other activities. And then he does mindfulness. If you pray, please pray with focus actually, and that makes a big difference. Then you eat on time, and the most important part is you sleep on time, because sleep is the most important thing which I would like to highlight here. Oh, I'm sorry. Then mindfulness. We talked about mindfulness during the last 2 days, and it's basically reset your mind. You need breaks. And what mindfulness means? Paying attention in the present moment without judgment. Whatever you are doing, you need to stay in present. If you're seeing patients, be with the patient. Don't be distracted by any phone calls. Please shut off your phones. If you're going in the room and seeing patient, so you need to take a break so that just take two breaths, so that you can just expel everything out of your mind. So see your patient with mindfulness. Like, be in the moment. You're eating food, be in the moment. Don't watch TV while having food, actually. Don't talk too much, while having food. So you will see your taste of food is going to be much better when you eat with mindfulness. And you will be eating less as well. There is a technique to lower stress. There's a course, we call it MBSR. It was designed by John Kabat-Zinn in Boston. There are 9 classes for that. If somebody wants to know more about MBSR to relieve anxiety, it's an excellent course for anxiety. So they can go online and watch the YouTube on that. The research on MBSR showed it increased activation of prefrontal cortex, increased gray matter density in the hippocampal area, and reduced gray matter density in amygdala. And mindfulness meditation promotes stronger connections between the prefrontal cortex and amygdala. Just a quick, what prefrontal cortex does, like empathy, insight, response flexibility, morality, intuition, emotional regulations. And what mindfulness does, it increases resilience, and then at the same time, by playing important role with interleukins, it also alleviates inflammation, and it also develops compassion and empathy for self and others, tolerance and resilience. Physicians burnout. We are using this word again and again. It's a lack of satisfaction with one's job, which may be due to hours, pay, or stress. And even the patient care also cause different kind of fatigue. We call it compassion fatigue. Always remember, the last line, which I'm going to highlight here, is this one. Self-care is essential. Before the heart sends blood anywhere else, it sends blood to itself. So this is exactly what we need to do. We need to fix our health first before we are taking care of our patients. And what are the current societal environment today? It is extremely bad for prefrontal cortex, multitasking, addiction to distraction, media, phones, watches, stress overdose, sleep deprivation, too little exercise, and no brain breaks or downtime. Take brain breaks and be strategic. Sleep. Everyone should get at least 7 to 8 hours of sleep, which is very important. Why it is important? I want to show you this graph. I found out that our body is under the control of day and night. And one of the hormone which we don't pay attention, and that is melatonin. When we were in medical school, this is one of the hormone which I never paid attention. We just read one line that it comes from pineal gland and it helps in circadian rhythm. Every one of us knows about only these two lines actually. But believe me, I can tell you, this hormone is the main hormone. Like at night, what it does, it plays with cortisol, it plays with your norepinephrine and epinephrine, it plays with your insulin. So basically, when we mess up with this hormone like melatonin, everything gets disturbed in our body. So basically, by not sleeping on time, we are destroying the whole inside of our body and the hormonal system. And Sumbal is here, she can mention that as well later. What it does in metabolism, lower cortisol and glucose level, greater insulin sensitivity, higher daytime leptin. Leptin reduce food-seeking behavior so you don't gain weight, you stay healthy. Lower sympathetic tone and blood pressure, greater nighttime peripheral perfusion, increase stamina and faster cardiovascular recovery time. Enhance learning and memory, faster cognitive processing, DNA repair and histone remodeling, apoptosis and anti-cancer cytokines, TNF-alpha with better sleep. Recommendation for better sleep, always remember, don't put TV in your rooms. I've seen in Pakistan, everybody wants to have a big TV in their bedroom. So never ever put TV in your bedroom. Bedroom is only for sleep and intimacy. Establish regular sleep cycle for bedtime and wake time, bath, shower, use comfortable environment. And the other important thing is no caffeine after 3 p.m. or 4 p.m. And for physicians, I would like to say that one of the things which I noticed over years, over the last 25 years, that our way of practice medicine is very wrong. So what we do actually, most of the physicians, they are seeing patients late till 12 midnight. This is wrong because you are not promoting that kind of healthy behavior. What you are teaching your patient, because if an obese patient coming to me and he will ask me how I can lose weight, the first thing I ask him about his sleeping habit actually. And that determines everything, how he's having his lifestyle. So for physicians, please, you need to set the example, because you cannot say that the patient comes at night time. If the patient needs you, he will come during daytime as well. I'm gonna recap quickly. And the last part is stress reduction. I already mentioned to you, start settling down 1 hour before going to bed, including active relaxation. Stop working or doing stimulating activities 90 minutes before bed. Mitigate nighttime worrying, planning, ruminating, and try MBSR or some basic breathing exercises. And last but not the least, smoking. Don't smoke if you do, and don't use any risky substance if you do. So with this, I would conclude. And lastly, I will just mention in the last 2 days, whatever topics we were discussing here and whatever we were talking, it was all about lifestyle-related diseases actually. You just name it: heart disease, GERD, hypertension, diabetes. They're all lifestyle-related medical issues, So that's why lifestyle is important. Thank you so much.
Thank you very much, Dr. Nusram. Let food be your medicine and medicine be your food. Moving on for that topic, we'll be moving on to our next speaker. She has traveled all the way from San Francisco, California, Dr. Sumbul Beg. Dr. Sumbul Beg has lifestyle medication, lifestyle